It's RT International. Thanks for joining us. The UN is warning that the international Ebola epidemic must be controlled within 60 days or it could prove to be catastrophic. The head of the Ebola Emergency mission says the steps taken by countries so far are not nearly enough to beat the disease. Even in America, with its modern healthcare system, fears of a widespread outbreak are growing, as RT's Marina Portnaya now investigates.
The United States has its first confirmed case of Ebola.
In a country home to some of the world's most advanced hospitals and doctors, a single case of Ebola was expected to be properly contained and treated.
I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
Within a week, confidence surrounding America's capability to prevent an Ebola outbreak has been compromised.
Thomas Eric Duncan died today in a Dallas hospital, the first death from Ebola in the United States.
Now, the first individual to contract the deadly virus on U.S. soil is a female nurse who cared for the 42-year-old Liberian man while he was being treated at a Texas hospital. That same hospital sent Thomas Duncan home with antibiotics on September 26th after he initially sought treatment and told a nurse he had recently visited West Africa. A few days later, workers without any protective clothing clean up Duncan's vomit after he throws up outside his family's home before being sent back to the hospital. Roughly 50 people were reportedly being monitored after possibly coming into contact with Duncan before he was sent to the hospital.
The infection control protocols for Ebola have to be redoubled. They have to be drilled on, and they have to be taken very seriously. It has to be practiced more, basically. And the investigation, the results of the investigation, what happened there, have to be released, have to be used to improve the level of preparation in hospitals throughout the United States.
According to a new report, 3 out of 4 nurses in the U.S. say their hospital hasn't provided adequate training on Ebola, leaving America's healthcare system unprepared. National Nurses United, the largest union of registered nurses in the country, finds 36% of those surveyed say their hospitals do not have sufficient supplies, including face shields and fluid-resistant gowns, to care for an Ebola patient.
There needs to be a national priority to provide the personal protection for all healthcare workers in this country.
Airport workers are also concerned. Last week, nearly 200 airline cabin cleaners at New York's LaGuardia Airport went on strike over health and safety issues surrounding possible exposure to Ebola.
I don't feel safe. I feel like I will catch any disease because we're not adequately equipped to deal with it, and we're not adequately protected
or adequately funded to deal with an outbreak. Since 2002, Washington has reportedly cut $1 billion in federal funding for public health preparedness and response activities. The World Health Organization warns that within 2 months, West Africa could face up to 10,000 new Ebola cases per week. It's little wonder why states in West Africa are failing to contain this outbreak when Western countries with all their resources and technology are struggling to deal effectively with just a few reported cases. Marina Portnaya, RT.
Ebola is not actually a new disease. The first cases were registered almost 40 years ago. This in the Congo and Sudan. 430 people died when the virus hit back then. Ebola came back in March this year, starting in Guinea and spreading to other Western African countries. It was then in September the first man was diagnosed with Ebola in America. A week later, though, it happened in Europe. And to date, so far, over 8,000 cases of Ebola have been registered, and more than half of them have indeed been fatal. In fact, we spoke to Laurent Duvier from the UNICEF for West and Central Africa. He says more funding is needed to fight the epidemic.
It would be more and more complicated to contain the Ebola outbreak if we don't have the resources to do what is necessary to mitigate the risk in the most affected countries, meaning Guinea, Sierra Leone, and Liberia. And just to give you an example, about 2 weeks ago, UNICEF made an appeal for $200 million, American dollars, and we've received only 25% of the resources that were required. That gives you a scale and of the magnitude of the challenge that we are facing and the constraints that we are facing. Of course, if we don't have the resources needed, it's very difficult to have a humanitarian response that is at scale and up to speed.